Hey guys, welcome back to the channel. Today we're talking about a tiny plant-derived drug that can make your heart beat stronger, but if you mess up the dose, it can actually be deadly. Yep, I'm talking about cardiac glycosides, especially digoxin. Let's break it down step by step, simple, clear, and fun. What are cardiac glycosides? So first things first, what are they? Cardiac glycosides are medicines that come from the foxglove plant, also called digitalis. That's why we sometimes call them digitalis glycosides. The most famous one? Digoxin. There's also digitoxin, but digoxin is the star of the show in modern medicine. Their superpower? They act like a booster for the heart, making it contract harder and pump more blood. That's why we call them cardiotonic agents. Mechanism of action. Okay, here's the fun part. How does digoxin actually work? Think of your heart cell like a little factory with ion pumps and doors. Digoxin blocks one special pump called the Na+, K+ ATPase pump. Let's walk through the domino effect. Pump blocked, so sodium, Na, starts piling up inside the cell. Because sodium builds up, the Na+, Ca2+ exchanger slows down. This means less calcium leaves the cell and more calcium stays inside. Extra calcium gets stored in the cell's warehouse, or sarcoplasmic reticulum. When the heart contracts, boom, stronger squeeze. That's why we call it a positive inotrope. But wait, there's more. Digoxin also increases vagus nerve activity, slowing conduction through the AV node. Translation? It not only makes the heart pump harder, it also slows down a fast heartbeat, especially in atrial fibrillation. Pretty cool, right? Indications. So, when do doctors actually use digoxin? Congestive heart failure, when the heart is weak and can't pump enough blood. Atrial fibrillation and atrial flutter, to slow the heart rate down. Paroxysmal supraventricular tachycardia, or PSVT. Sometimes in left ventricular failure. In short, weak pump, fast chaotic rhythm, digoxin can help. Contraindications and precautions, but it's not for everyone. Don't use it if you're allergic to it or if you have certain heart muscle blockages. Be super careful in patients with a recent heart attack, MI, high blood pressure, thyroid problems, electrolyte imbalances like low potassium or high calcium, kidney disease, and of course, elderly patients. Side effects and toxicity. Now, here's the scary part, side effects. Because the safe dose and the toxic dose are super close, we say it has a narrow therapeutic index. What happens if levels go too high? Nausea, vomiting, stomach pain, loss of appetite, headache, confusion, vision changes. A classic one is seeing the world through a weird Instagram filter. Slow heartbeat or dangerous arrhythmias. Yep. This drug can actually trigger the very heart problems it's supposed to fix if you're not careful. Dose and monitoring. Typical daily dose is around 0.125 to 0.25 milligrams. Doctors check blood levels after about a week to make sure it's in the safe range. 0.5 to 0.9 nanograms per milliliter for heart failure. They also monitor kidney function, electrolytes, potassium, magnesium, and calcium, and ECG for rhythm changes. Basically, digoxin therapy equals constant babysitting.
Interactions. Another catch, digoxin doesn't play nice with other drugs. Some meds increase its levels, like amiodarone, quinidine, verapamil, and macrolide antibiotics. Others, like diuretics, can lower potassium and make digoxin more toxic. So if a patient is on digoxin, you must double-check every new prescription. Toxicity management. Okay, let's say someone overdoses on digoxin. What do? Stop the drug immediately. Treat symptoms. Atropine for slow heart rate, lidocaine for arrhythmias. Correct electrolytes. And the hero of the story? Digoxin Immune Fab, or Digifab, or Digibind. This is basically an antidote that grabs onto digoxin and pulls it out of action. It's life-saving in severe cases. Key takeaways. So to sum it up, digoxin equals a plant-based drug that makes the heart pump harder. Works by blocking Na+, K+ pump, so more calcium, stronger contractions. Useful in heart failure and atrial fibrillation. But it has a super narrow safety margin. Too little equals no effect. Too much? Dangerous arrhythmias. Always monitor levels, kidneys, electrolytes, and watch for drug interactions. And that's cardiac glycosides in a nutshell. Small drug, big effects, both good and bad. If you found this breakdown helpful, smash that like button, subscribe for more simple pharmacology explainers, and let me know in the comments, which drug should I cover next? Thanks for watching, and see you in the next one.